So what I presented today at this meeting was the role of RNAs, small RNAs, as potential liquid biopsy markers for detecting cancers, particularly gastrointestinal cancers. There's a lot of interest in small RNAs because these have been found to be very stable in cancers. We can easily find them. We can find them enough in numbers. We can find them in high specificity, so which is very important. Then whether they're specific for cancer patients or not, we can find them enough. It means they're very, very sensitive. So we can detect them in blood, we can detect them in feces, we can detect them in saliva. So the point is, can we use these small RNA markers for the early detection of cancers, which is very, very important, especially when it comes to GI cancers, that if you can find these cancers early on, you can help the patients a lot more. But so far, the tools we have don't help us because most cancer patients are diagnosed at a very late stage. So the big focus of our research has been early detection of cancers, and we have what we shared today in this presentation was a lot of different sorts of evidence which point to the direction that these small RNAs are stable, they can be easily detected, they have some level of specificity. Yes, we need to work more, but they offer specificity, and if we can come up with a good panel of markers, we can really help the patients a lot more by early detection of their cancers. We are working on predictive markers as well, predicting which of these patients are going to develop a metastatic disease, which of these patients are going to develop recurrence, which of these patients are not going to do so well. So we have quite a few markers which we can measure as liquid biopsies in serum or plasma of patients, which can predict their risk for a recurrent disease or a more high-risk disease. Yes, so in terms of heterogeneity, that's a challenge, and I think that's where these small RNAs or even DNA-based markers in liquid biopsy work better, because when we do a physical biopsy of the tumor, we know that the tumors are very heterogeneous. So it's possible that you can only pick very selective number of cells, and you obtain information, you gather everything, and you determine the treatment plan or management of the patient based on those few cells. But those cells may be misleading. So I think having detection of these tumor cells in circulation, whether it's DNA or RNAs, probably offers a much more unbiased approach at looking at all these cells freely floating in blood and then make a more informed decision, which is probably more important than, in some ways, of course, we need to have more data, but in some ways it may be more important than having physical biopsies. So at our institute, we are in the process of initiating 2 or 3 different clinical trials where we are going to be looking at patients who develop colorectal cancer, patients who develop pancreatic cancer, as well as esophageal cancer. So we are developing these trials for prospective enrollment of patients, drawing their tissues as well as blood at the same time, so we can do match analysis and probably reach a panel of markers which can be used as liquid biopsy markers.